Hello, I will discuss a bed bath of the whole face, the one arm, the hand, and the armpit. We want to make sure we grab all our materials. We need 2 washcloths, 2 towels, a bath blanket, a clean gown. And we want to practice hand hygiene. We're going to grab some hand sanitizer and rub all the surface of the hands until they're completely dry. We're gonna knock on the door, get permission to enter the room, and introduce ourselves by name, title, and what we're gonna do. Hi, Mr. Jones. We're going to give you a bed bath. We're gonna wash your face, do your arm, hand, and your armpit. Okay. We're gonna use one of the towels to provide a protective barrier on the table that we're working on. And we're gonna grab that basin and fill it up with warm water and have the resident test it to see if it is comfortable. I'm going to set it down, and before we begin working, we need to provide them privacy and raise the bed to a comfortable working height. We're going to put that bath blanket over the resident so that way we can put the blanket down without exposing them, probably about down to their waist, and we're going to remove that gown that they're wearing without exposing them the whole time. First, we're going to begin by, okay, the bath blanket's on them, so we can wash their face now. We're going to use a washcloth, get it wet, just water, no soap. Just get the eyes, the nose, forehead, the cheeks, the mouth, and set it off to the side, and we grab our towel and pat dry their face. I'm going to use that towel. It's not completely wet. It's just a little damp. We're going to put it under that arm. We're going to grab another washcloth and get it nice and wet and get some soap. And we're going to wash that arm and the hand and the armpit. Put that off to the side. I'm going to grab that wet washcloth, wet it again, rinse it out. And we're going to rinse off that soapy arm, the hand, and the armpit. And then using that towel that's under the arm, we're going to pat it nice and dry. Okay, now we can remove that towel, and we're going to set it off to the side, either to the foot of the bed or on the side table with the protective barrier. I'm going to grab a new gown, and we're going to get that resident dressed, trying not to expose them the entire time. And at that point, we can remove the bath blanket and put off to the side to retrieve later. And we can cover them back up with a blanket. Okay, now that we're done washing them, they're properly dressed and covered, we can lower the bed to the lowest position before we walk away and do our cleanup. Okay, so I'm going to grab the basin. I'm going to dump it into the toilet, grab some rinse water, and of course that rinse water is going to go right back into the toilet. And we're going to dry it off with some paper towel, throw that into the garbage. And we're going to put that in the proper storage area. Now we're going to gather up our soiled linens, the dirty washcloths, the towels, the old gown, and the bath blankets, and put it into the hamper. And before we go, we're going to make sure that the resident has the call light within reach, and we're maintaining a dignified, courteous interaction with this resident at all times. We're going to also sanitize or disinfect our hands. We're going to do that by grabbing some more hand sanitizer. We're going to rub it throughout the whole surface of the hands, and we're going to rub them until it's completely dry. Skill complete.